In this video, we will go over basics of stroke. This video is for educational purpose only and not indicated for clinical use. Stroke, also known as a cerebrovascular accident, is caused by loss of blood flow and oxygen to a region of the brain, resulting in neurological deficits. There are mainly three types of stroke: ischemic, hemorrhagic, and transient ischemic attack. Ischemic stroke accounts for about 80% of all strokes and is caused by plaque formation and/or clots blocking blood flow to the brain. Hemorrhagic stroke occurs when a weakened vessel ruptures and bleeds into the surrounding brain, causing lack of blood flow. I will go over these two types in more detail in separate videos. Transient ischemic accidents occur when blood supply to a part of the brain is briefly interrupted, causing a transient episode of neurodeficits without evidence of infarction on imaging. TIAs are often warning signs that a patient is at risk for a more serious and debilitating stroke. Signs and symptoms. It is almost impossible to differentiate between an ischemic stroke and a hemorrhagic stroke based on symptoms. However, time is brain applies to any type of stroke, because the faster a patient who is having a stroke receives treatment, the better the chances of a complete recovery. The B-FAST acronym helps to identify signs and symptoms of stroke. B stands for balance, such as sudden loss of balance or coordination. E stands for eyes. Is there a sudden vision change or troubling seeing? F stands for face. Does one side of the face droop when the patient smiles? A stands for arms and legs. Is there weakness on one side of the arm and leg? S stands for speech. Is this patient suddenly having slurred, slow, or strange speech? Or are they having trouble understanding speech? T stands for time. If stroke symptoms are suspected, call 911 immediately or activate the rapid response team or a code stroke in acute care centers. Code stroke team usually consists of a rapid response nurse or ICU nurse, a physician, and a neurologist that will make a rapid and accurate assessment, diagnosis, and initiate interventions. The NIHSS is a numeric scale that measures neurological deficits based on the patient's performance in 11 items. It is a quantitative measure that can be communicated easily and is not affected by any assumptions or bias of the assessor. It also predicts short and long-term outcome of the stroke. A total score of 0 to 5 indicates a minor stroke, 5 to 20 is moderate to severe, and more than 20 is severe. There are a lot of instructional videos on how to perform NIHSS assessment on YouTube. Lastly, I will go over some common terminology used when describing stroke symptoms. For example, ataxia means unsteady gait and inability to keep feet together. Paresthesia refers to numbness and tingling of extremities. Hemiparesis refers to weakness of one side of the body, such as face, arm, and leg on the same side. Hemiplegia is paralysis of one side of the body. Neglect happens when the patient loses awareness of one side of their body. For example, the patient may miss things on the affected side, such as not eating food on one side of the plate. Dysphagia means having difficulty swallowing due to muscle weakness in the throat. Dysarthria means difficulty phonating words due to the physical weakness of the facial muscles. Dysarthria is a motor speech disorder, while aphasia is a language disorder in which the brain is unable to process language. For example, expressive aphasia refers to when the patient knows what they want to say, but they have difficulty creating meaningful and coherent speech. Receptive aphasia, on the other hand, occurs when the patient is unable to read and understand spoken words. Thank you for watching this video. I will go over ischemic and hemorrhagic stroke in detail in the next two videos. See you next time.